So welcome to this week's video newsletter. I'm actually in my kitchen at home today. There's I can find anywhere quiet in the office to record this, and Microsoft's being used for some sessions today. So I thought I'd set up in the kitchen, so this is my kitchen. So I want to talk about something today which we're actually going to be covering on a Secrets to Recovery call next week, which is around motivation. You know, I'm sure people are well aware, having listened to our stuff before and know they're in a situation, that we in no way believe that ME is a psychological illness. But having the right psychology on the path to recovery makes a big difference. And one of the things which we find really makes a difference is being able to stay motivated. Now, it's not being motivated that gets somebody well. In fact, pushing through when we're ill slows down our recovery path, and that pushing ourselves too hard is often what makes us sick in the first place. So I'm not talking about pushing here. What I'm talking about is staying motivated, staying kind of set on the goal, staying inspired that we're going to get there, even when we feel like we're stuck or we're not moving forwards. And I think this is especially difficult when often what we need to be motivated to be doing is to be doing things that are outside of our comfort zone. Be that really being disciplined on consistently calming down our nervous system, for example. And if you've learned some of the tools and techniques with the clinic to do that, it takes a lot of focus, a lot of motivation to keep catching those patterns and stopping them and changing them. So I just wanted to give a useful metaphor in this video newsletter, which I found really helpful in my life, and I know that for a lot of our patients it's also been helpful, which is to see motivation and inspiration as being like a muscle. That the more you work it out, the stronger it gets. So it's like if you go to a gym and you lift a weight for the first time. I don't mean go to the gym on your recovery path, but you know, when you're well and you do that, when you lift a weight, at which repetition does the muscle grow? It's on number 11, isn't it? If you're used to doing 10, it's the one where you're kind of like, you're kind of a constipated look, eyes bursting out of your face, you're really straining the muscle. That's where the muscle grows. And the same is true with emotional muscles. So when we're at a place where we feel like we've tried everything and nothing's working, and in that moment, we catch one of our patterns and we do something to change it. In that moment, we grow. In that moment, we make a shift in our recovery. And I think that's a really helpful way of thinking about motivation. That you see it that the times when you feel least motivated, that's the opportunity to grow. So it's almost like when you have a really bad day, there's the potential for something to change. We're in London, you probably hear the sirens in the background. It's the potential for something to change, but the change is not necessarily doing what you would habitually do. So as I'm saying, it's not about being motivated to push through. It may be having the motivation to stop and to rest and to calm your system down. Because often what happens is the worse we feel, the less we want to rest, because in some ways we don't want to connect into ourselves, we just want to keep on pushing through. So what I'd like to think about is what are 3 areas in your life you could look at your motivation and see these areas as an opportunity to grow. To grow in your connection to yourself, in your healing state, in your moving forwards, in staying focused on what you're doing. And see how you can do that. And if you're interested in finding out more, we're going to cover much more on this in the Secrets to Recovery call next week. But whether or not you remember, I still thought this was a useful kind of thing to be thinking about. And if you're a current patient in the clinic, I'm sure by now you've received the Secrets to Recovery book, which I hope you've been enjoying and been making the time to read and to kind of sharing those stories. So thanks for watching. I look forward to speaking with you again next week.